Okay, let's jump right into this explainer and play a little medical detective. You know, every single time your heart beats, this invisible spark travels through a microscopic high-speed electrical highway. But what happens when that spark hits a roadblock? Today, we're going to decode the complex electrical signals and spatial movements hiding inside a patient's ECG and uncover exactly what's going on during a bundle branch block. Here's a quick look at our roadmap. We'll start with the heart's normal electrical highway. Look at what happens when there's a roadblock, bring in our chest leads to investigate, learn a pretty awesome mnemonic called MaRRoW, and wrap up with how we actually fix the block. All right, part 1, the heart's electrical highway. To spot what's wrong, we kind of need to know what perfect looks like first, right? In a healthy heart, once the signal hits the AV node and the bundle of His, it splits perfectly evenly down the left and right bundle branches. This high-speed Purkinje fiber network guarantees that both ventricles contract at the exact same synchronized moment. Honestly, it's a total masterpiece of biological timing.
Moving right along to part 2, roadblocks, or bundle branch blocks.
So, a bundle branch block is exactly what it sounds like. It happens when that vital electrical signal gets completely blocked or just really held up along either the left or the right branch. If the signal is blocked on one side, it literally can't use that high-speed highway anymore. Instead, it's forced to take this slow, agonizing detour through the surrounding heart muscle just to get to the other side. And because of that sluggish detour, the ventricle on the blocked side gets the signal late, meaning it contracts totally out of sync with its partner.
Now, you might be wondering, what actually causes this roadblock? Well, it usually comes down to fibrosis, which is essentially just scarring of the heart tissue. This scarring can happen out of nowhere from a sudden acute event like ischemia or myocarditis, or it can be a slow burn, building up from chronic conditions like hypertension or coronary artery disease that slowly remodel the tissue over time.
So how does this muscular detour actually show up on paper? The magic number you want to remember here is 120 milliseconds. Normally, a QRS complex is snappy, taking just 80 to 100 milliseconds. But because that detour forces one ventricle to start and finish late, it stretches the entire process out. So if you see a QRS wider than 120 milliseconds, that is your very first major clue that you're dealing with a block.
Which brings us to part 3, the ECG detective and chest leads. Now, standard limb leads are great for getting the big picture, but they only show us the heart in the frontal plane. If we really want to differentiate between a left and right block, switching to the precordial chest leads is absolutely essential. They give us this amazing cross-sectional view, looking at the electrical activity from a slice perfectly parallel to the ground.
Specifically, we really want to zoom in on leads V1 and V6. Picture V1 sitting right on the front of the chest, staring directly at the right ventricle. Meanwhile, V6 is wrapped around the left side, looking right at that massive left ventricle. Because they're geographically the farthest apart on the chest wall, they give us the most dramatic contrast. We get these opposing viewpoints that highlight exactly which direction our electrical detour is taking.
All right, part 4, the MaRRoW mnemonic. Let's start with a left bundle branch block. If the left branch is out of commission, the signal shoots down the right branch first. Then, that overall wave of depolarization has to slowly drag itself from the right side all the way over to the left side to get that left ventricle to contract. Because that energy is physically moving away from the front of the chest, away from V1, it creates a deep, negative downward deflection on the ECG that looks just like a W. And at the exact same time, that energy is moving directly toward V6 on the left, creating this large, often notched positive spike that looks like an M.
On the flip side, what happens in a right bundle branch block? Well, here the left side fires normally, but the right ventricle depolarizes late in a roundabout way. So that final surge of delayed energy moves from the left back toward the right side. Since it's surging toward V1 at the front of the chest, V1 ends up with a large terminal positive wave, forming an M shape. And because that same energy is running away from V6 on the left side, it pulls the reading down into a wide, slurred S wave, giving us a W shape.
And this brings us to what is basically the ultimate cheat code, the MaRRoW mnemonic. It's so brilliant. Think about the word William. The double L's stand for left bundle branch block. In a left block, V1 is a W and V6 is an M. William! Now look at the word MaRRoW. The double R's stand for right block. V1 is an M and V6 is a W. MaRRoW. It is just a perfectly elegant way to remember exactly what you're looking at.
Finally, Part 5, Fixing the Block.
So, the big question. How on earth do you fix a broken highway deep inside the heart muscle? Well, it's worth noting that some cases of bundle branch block are actually congenital, meaning they've been there since birth and the patient has absolutely zero symptoms. For those mild cases, we usually don't need to do anything at all. But what happens on the block is acquired from severe heart disease, and that delayed contraction starts making heart failure even worse.
When things get serious and cause a life-threatening loss of cardiac function, medical science steps in with a pretty incredible fix: the cardiac resynchronization pacemaker. Instead of just stimulating one chamber like a standard pacemaker, this device uses electrical leads strategically placed in both the left and right ventricles. It literally bypasses the roadblock completely. By pacing both sides at the exact same time, it forces those ventricles back into a synchronized rhythm, dramatically improving the heart's pumping efficiency and getting that electrical highway back to normal.
A bundle branch block is just one fascinating detour on the massive electrical map of the human body. But think about it. If you can learn to read the subtle voltage changes across chest leads V1 and V6 to spot a microscopic scar deep in the heart, what other incredible cardiac mysteries are waiting for you to decode? If just this single slice of perspective can reveal so much, how completely will your understanding of human health change once you learn to read the rest of the map?